what an honor. When you hear you win an award like this, it sounds really cool. But when they put a video together of people talking about you, it gets way cooler. So thank you for that. And thank you for those that made that video possible. I want to start by congratulating the other award winners. Your work does not go unnoticed in our profession. It's very important, and I applaud the OCA for acknowledging people's contributions every year the way they do. Also, congratulations to the OCA on their 90th anniversary. It's extra special to receive this award tonight, especially when you're honoring two of my favorite colleagues, Bob and Greg, both of whom have been personal, strong influences in my career. So thank you to the OCA as well for being a consistent positive force within our profession throughout my career and the careers of many in this room. We've been together for a long time, the OCA and me, haven't we, Natalie? We have. Yeah. The OCA was actually the first bigger association to take a risk on my company. We're going to call it an early adopter of my work in RRS education. And actually, they were my first big association conference to speak at. And the ironic part about that is that's where I met Richard Brown, actually, who you saw in the video there, who's now a great friend and mentor and colleague of ours. He spoke before me that day, so that's where we met. So these things sort of happen in a good pattern that way. I know with great personal experience that navigating the advocacy side of our profession is not always easy, right? It's not. But our collective progress with guidance, strong support, and good work from the CCA and collaboration with the other provinces has been consistent and forward-facing. So let's keep going with that, shall we? My journey thus far in our profession has certainly been unique, but I think it's unfolding the exact way that it should. I'm certainly fortunate, but I'll add that I've worked pretty hard to become a trusted member of a variety of different spheres of influence or areas in our profession, be it the clinical side of treating patients, or education, or advocacy, or association work, medical legal work, and so on. And I treasure all of those parts of my career. As you've seen from the video, I'm humbled to have such great friends, mentors, and colleagues that I get to work with on a daily basis, and thanks again to those who contributed to that video. When you win something like this, it creates a moment of self-reflection in a way, and I truly value my position in our profession. However you really want to define my position, I'm a little bit in the middle of everything, and that's partly by design and partly by accident, I think. And what I value most is my role as what I consider at least a trusted liaison between those of you, most of you in the room, who see patients every day and do the important work that matters where the rubber hits the road, and our scientists, whether it be our scientists within our profession or our scientists in other professions who do work around what we do in clinical practice. The scientists support us in terms of what we do in practice and advance not only our science, but our presence in modern healthcare as an evidence-based profession. Both groups, clinicians and scientists, provide undeniable value for everything we do, and I think fostering mutual understanding and support will do nothing but raise our cultural authority as we go forward, and I think that's important to foster that relationship. In my 15 years of doing this so far, I've thoroughly enjoyed getting to meet many of you in this room, and familiar faces were mentioned earlier, and that's something that I treasure about these events as well. More recently, I've met lots of our colleagues around Canada, and more recently, globally. And what I can guarantee all of you in this room, and most of you know this, we are a profession of caring, passionate, and dedicated people. And I don't think anyone can take that away from us at all. The support I've received from this profession has allowed me to pursue what I want to do in my career, and I treasure that role and take it very seriously. And knowledge transfer, as getting research into practicing clinicians' scope in a way that matters to them, is a responsibility that's not unique to chiropractic. Lots of professions struggle with that these days, and I'm proud to be a part of that in our profession in any way that I can be. We, I think as a group, especially since I started the company in 2006, I think, if I recall, our landscape now for research as a profession is certainly different than it was then. It's much, much stronger. And I've said this in other talks I've done before. When I started doing weekly reviews of research and committing to doing those weekly, I was literally worried in 2006 that we wouldn't have enough papers that were worthwhile to do. Now, as many in the room know, I kind of have the opposite problem of picking which ones to review. And I think that's something we should all be proud of. There's other good news. Many things are aligning perfectly for our profession at the moment, and that's been alluded to a couple of times tonight already. And I will agree, and many others have said, there's never really been a better time to be a chiropractor. We're enjoying a unique confluence of really strong and important forces that are kind of coming together all at the same time for us to open doors both locally and globally. That's very important. And they include unprecedented awareness of the burden of neuromusculoskeletal disorders, particularly back pain and neck pain. They're right at the top. Research support to enhance and prop up what we do as a profession, and also a push for improved public health and healthy aging. There are more, but I'll stop there. You get the point. These opportunities presented to us as a profession now are real and substantial. But no one said it would be easy, right? Nothing is handed to anybody in life these days. And anything worth achieving comes with a few challenges along the way. But if I have the opportunity to be clear about anything tonight, I want to be clear about this. Attempts to derail our evolution and progress as a profession, both from outside and within our own ranks, will not succeed. As our story progresses and unfolds in the coming years, our collective behavior and action as a profession will determine our future. And the good news is, it's within our control and it's our choice. And that's something unique and that not every profession has. So with the right engagement and action from the majority of our profession, our continued journey in the global interdisciplinary healthcare environment will be successful. The world of healthcare operates on an economy of information, and the main currencies are patient outcomes and research these days. We have to accept this and not only behave, but contribute accordingly. Those are two different things. We must be confident, but collaborative, and helpful, but humble as a profession. Our future in the next decade, as we enter another 10 years, and I sort of start thinking about this at my age, what are we going to look like in the next 10 years? Our future is bright, and in my opinion, certain, if we do things properly, and quality always wins. And I think we have that on our side. As I get a little bit older, I guess, especially in the past few years as a father to two young sons, I've started to appreciate my own parents a little bit more, and I think I did already in the first place. And that's kind of a cosmic draw that we all enter, right, when you're born. You can't pick your parents, unfortunately. But I was really lucky in that cosmic draw. And both of them have been and remain strong influences in everything that I do. Many of you know my mom, Jay. When you email tech support on my company, you're talking to my mom just in case you want to be rude. So a lot of you have run into my mom at some point on email, at least. So thanks, Mom and Dad. Finally, literally nothing in my life, whether professional nor personal, would be possible without my amazing wife, Katie. She's right over there. Woo! I suspect the clapping was because they know you have to put up with me to some degree. She's the best, and I don't know how else to say that, and she's my rock. I think if Dr. Wicks is open to it, where's David? Over there. Can we give out honorary chiropractic degrees? Because she should get one, at least a political one at this point.
Isla has one.
Isla has I'm going to bring Isla up in a moment to answer that. But she should at least get an honorary political degree in chiropractic at this point. The only two people I know luckier than me to have her in our lives are my two sons, Calvin and Everett, that get to call her mom, and she does a great job with that too. In closing, I did not go to the Greg Dunn School of Speech Writing. It's a little bit longer, but I feel privileged, truly, to join the esteemed list of colleagues who received this honor previously. It's very special to do it on an anniversary. It's always special to do it with friends and colleagues. And to everyone in the room, my colleagues, my family, all the mentors that I've had, and many of you check many of those boxes, and I think that's critical. I truly thank you for everything that you've done for me. Your inspiration, trust, and support are things that I truly value. And all of you push me to be better, and I also treasure that opportunity and take it quite seriously, so thank you again. Thank you once again to the OCA. Congratulations again to the other award winners, and it's probably about time we start enjoying the evening and a little bit more wine. So thank you so much for your support as a profession, and have a good night, and happy holidays.